morning and welcome to another edition of FSACCI's COVID-19 webinar series. Today we are going to be discussing COVID-19 within a South African and African context. And here joining us today is Dr. Thinus Marais, who is the medical head for Africa for Sanofi-Pasteur. Welcome to you, Thinus. For those who have been following this webinar series over the last couple of weeks, you know, we've dealt quite specifically with business issues from banking to the economic impacts to how to manage your crisis communication. But today is really the opportunity to get down in the details with Thinus today on the actual disease itself, its epidemiology, as well as the impact and management of other infectious diseases, as well as looking at this disease really in the context of South Africa and of Africa as well. So before we get started, I'd like to say a warm welcome to all of our members joining us today, as well as to the members of the Belgium Chamber who are co-hosting us today. I see Claudine is with us. Welcome, Claudine. And also just a big warm welcome to those joining us from across Africa, from our various sister chambers across the continent. Welcome to all of you today. I see we have quite a few people coming in, so welcome I see we have Clarice, welcome to Charles, Alexandre, welcome to all of you. So those who've just joined us, we're going to be chatting with Dr. Thinus Marais today, and we're going to be looking at the disease and the current epidemiology of coronavirus, looking at its impact on other infectious diseases, as well as some helpful resources as well. The format of today's webinar is going to be a very brief 15-minute introduction from Dr. Marais, but really today's session is about having a dialogue and really it's an opportunity for you to ask your questions and lean on the expertise of Thinus here today. So please, as always, we encourage you to ask your questions. You can do so either by raising your hand and we will unmute you. Alternatively, you can pose your questions below in the Q&A box. So like I said, we will have that opportunity for a longer dialogue session today. So please don't be shy to ask your questions. And alternatively, if you have any specific questions or points of clarity that you would like to ask during the presentation, you're more than welcome to raise your hand and Thinus will deal with them directly at that point in time. So I think on that note, I would like to hand over to you, Thinus. Thank you for joining us today.
Great. Thank you very much, Amy, for having me. I think this is a good opportunity to also I think bring some light to the medical side of the disease. I'm going to share my screen with you at the moment, and the idea really here in terms of my presentation, just to give you with you today, but I really try to keep it visual, to keep it interesting and topical. I promise I'm going to try and not go into too much detail, but if at any point you feel like I'm losing you, as Amy has said, please let her know, and we'll address your question, because I'd prefer to keep us all on the same page as we go through the presentation. I'm just sharing with you a couple of concepts really, and the purpose of this is hopefully so that we can start and have a nice dialogue after the presentation. So if we get right into it, from a background perspective, coronaviruses are a large family of viruses. These are common in people and also many different species of animals, which includes camels, cattle, cats, and bats. If you're not aware of it, I think a very important point to note is that there are coronaviruses currently that commonly spread in humans. Don't worry about these codes, but the point is there are 4 common coronaviruses that circulate in humans seasonally at the moment. So we see them mostly in the winter seasons. And they are responsible for about 30% of colds that we see in winter season. So not a brand new virus per se, and we do see some coronaviruses that circulate quite commonly in humans. I think that's an important point for you to just keep in the back of your mind. So when we get to COVID-19, or also known as coronavirus disease 2019, this is a disease caused by SARS-CoV-2, that's severe acute respiratory syndrome coronavirus 2. So that's just the name that they've given the virus that causes COVID-19. This is the 3rd coronavirus to emerge in human populations in the past 2 decades. And this follows MERS-CoV and SARS-CoV. So you may have heard this in the media. MERS was around 2011. SARS reared its head in about 2002, 2003. Now, for all three of these viruses, they have their origin in bats. How do we know this? Through genetic sequencing, they're able to see that all three of these viruses are genetically very much linked to coronaviruses that circulate in bats. MERS had an intermediate host and still has an intermediate host of camels, and this disease is still endemic in the Middle East countries. SARS had an intermediate of a civet cat, and that was you contracted the disease through diet or close contact to this intermediate. For SARS-CoV-2 or for COVID-19, we're still not 100% sure whether there is an intermediate or what it was. Current opinions lead towards pangolins, but really sort of the wildlife or the wild meat industry obviously involved in this process. Mode of transmission from the animal also, whether it be from the bat or the intermediate, is not perfectly clear for us at this point in time. In terms of the clinical course of disease, the transmission for coronaviruses in general is through droplet or saliva. So that's transmission from human to human. Clinical outcomes of the disease, here you see again the 4 common circulating coronaviruses we see in humans that cause colds. Generally, disease outcome here is mild. For COVID-19, it's quite a wide range of clinical outcomes, starting from asymptomatic, in fact, so you can get the disease and show no symptoms at all, ranging from mild, medium to severe illness. For SARS and MERS, generally the disease outcomes there were quite severe. From a burden of disease perspective, and this really only focuses on COVID-19, you can see that only 5% of the total cases become critically ill, 15% of them develop a severe infection, and these would be the individuals that need some kind of support breathing, so oxygen therapy as an example. But you can see the vast majority of cases, in fact, are non-severe cases. And I think it's an important point for us to keep in mind. I think there's a lot of panic out there, a lot of stress about the virus, but we need to keep these contextual elements in the back of our minds as we continue to discuss the topic. I'm not going to take you into too much detail of this slide, don't worry. The only thing I want you to know, because when we get to the various treatment options, this becomes important. So the only message I really have for you on this slide is in the clinical course of the disease, there's a viral element. So the virus that damages the body causes certain symptoms and certain issues within the body. But then at some point, we've also noticed that there is a host immune response. So that means the infected individual or the human has an exaggerated immune response to this virus. And that exaggerated immune response then also causes damage in the body. And it's really on the viral side and on the host immune response side where we're hoping we could impact with some of the therapies. That's the only thing I need you to know from this slide. So who is at risk of contracting COVID-19? And this is important. So what we see from the data is that those aged over the age of 60 are most at risk. And here you can see these are studies from Italy and the UK, percentage of deceased, and you can see that the number of individuals that succumb to the disease are certainly in that aged population category. Over and above that, especially those with existing conditions seem to have a worse outcome. And you can see here some of the common existing conditions that they have seen in individuals that have died from coronavirus disease. Important to note, if they have these conditions in multiples, the disease outcome even becomes worse. So you can see that 48% of deaths in this study had 3 or more of these conditions when they succumb to the disease. So what is the situation like today? We're in the middle of a pandemic. It's quite difficult to build a presentation in the middle of a pandemic and make sure that the data is as accurate and as recent as possible. So this was drawn yesterday, and I thought it's just interesting to show you maybe a sort of different representation of the data. And this is to show where coronavirus is rising and falling within the current pandemic space. And this, countries on the left here, you can see are showing less new infections on a daily basis, or have started to plateau. And you see the closer you come to the center, or the further away you move from the center, the higher that percentage is. In terms of countries that are still actively seeing a lot of new cases, you can see some examples here from a South African perspective. There's South Africa, Egypt. I see Algeria is not notable in this one, but those are the three main countries in Africa that are currently seeing new cases. And then important to note here, just on a general basis, so the number of new confirmed COVID cases globally have started to plateau off, which means we're probably on the plateau of our epidemic curve at the moment, but we'll see how that evolves. Worryingly, 8 out of 10 of the world's most populous countries are now faced with increasing COVID-19 cases. Interesting case study, South Korea are one of the countries that have actually managed the disease incredibly well. And they saw a plateau and even a decrease, marked decrease in their cases. And then after tentatively reopening their economy, they're now facing a new wave of cases. This is not strange. I'll show you later towards the end of the presentation when we start looking at what potential outcomes are and what the future looks like. I think this is what we're going to certainly see in many of our countries. So if we look at the total African perspective here in terms of numbers of cases, I think ad nauseum you have heard of the words flattening the curve. And this is what they mean by that. And you see on this graph, I selected out all the African countries. And I sort of thought it's important to draw a comparison to maybe a first world country such as the United States. And you can see how sharply the US cases rose over a period of time. And only now really are they starting to hopefully see the plateau of their curve. And in contrast to that, you can see how many of the African countries have a much flatter progression of cases. And I think at this point, it's important for me to just note that if we talk about a lockdown or a lockdown period and the purpose of flattening the curve, it doesn't mean we're taking away the number of cases we're going to see. It just means we're buying time, because our healthcare systems are quite fragile and can potentially not manage huge quantities of new disease per day. And I think to a large extent, we've successfully managed to do that over the last month or so. So how does COVID-19 stack up to other diseases? And this is an important point that we need to discuss as well, because we can often get quite bogged up in the current pandemic, and the only thing people talk about is COVID. But it's important, and especially in an African context, that we discuss this within the context of other diseases as well. This is a really nice infographic that just shows you pandemics throughout sort of our modern history. And what their impact was, and the number of deaths that were caused. And very important for me to just draw the comparison for you here, that we're still in the middle of an HIV and AIDS pandemic. It's not gone away. It's something we're still trying to manage, and Africa certainly at the bigger end of the disease burden carrying brunt here. So, and you can see that 25 to 30 million people have succumbed to this disease. And in contrast to all of these, you see this is where COVID-19 currently stacks up. Very recently, obviously, Africa also battled with an Ebola outbreak. So, so in terms of bearing brunts of these diseases, unfortunately, Africa is very frequently at the top of the list. I'm not going to go into massive amounts of epidemiological details with you, but the one concept I think that's important to understand is what they call the RO number, which is the basic reproductive number of a disease. That very simply means, and this graph explains it very nicely, how many people will get infected for every person that contracts the disease. That's what an RO number means. So you can see for COVID, and let's look at the coronaviruses first, it states that for every person infected, 2.5 people around them will contract the disease. So it speaks to the infectivity of the disease. SARS you saw is a little bit higher. MERS is much lower than COVID. So those are the three coronaviruses. And then we contrast that to a number of other diseases. The only other one I want to bring your attention to, because it's important in the African context, is measles. and see how incredibly infective measles is. So for every person that is infected with measles, an additional 16 people around them will contract the disease, and you'll see in the coming slides why this is an important point. Again, if we compare it to other diseases, how does it stack up? And this is really, for me, where the African context comes front and center. And this graph shows you the average diseases or disease deaths per day worldwide. And you see where Corona is currently at about 2,000 deaths per day worldwide. But if you put yourself in the African shoes, you see tuberculosis remains the #1 killer. And this is globally, but certainly more on an African basis. Hepatitis B, pneumonia, and HIV and AIDS. So if you're in a first world country at present, if you're in the UK or in the US, one can understand where that panic for COVID comes from, because it is currently their biggest killer. They're not battling with the rates of TB and HIV as the African countries are. But on top of managing a COVID crisis, many of these African countries are still at the front end of TB and HIV deaths, and it's important that we see it within this context. If we talk about contagious or how deadly COVID-19 is, and here you see at the bottom they plotted the R number that we discussed earlier, which speaks to the infectiousness of the disease, and then plotted that against the fatality rate. Obviously, I'm not going to spend too much time also talking about fatality rate, because as the graph correctly states, these are unreliable in the midst of a pandemic. We'll not really know what these true numbers are unless we have really good data to back that up, and that's still forthcoming at the present time. Important in the African context to look at what the impact of the pandemic is on other diseases. I'm sorry, the slide is not going to leave you feeling great, but I think it's important that we just understand what we're dealing with outside of or in the midst of the things we put in place to hopefully battle COVID-19 has got an effect. So if we look at malaria, they say here in the worst case where preventative measures are suspended because of social distancing, etc., and access to anti-malarial medicines falls drastically, malaria deaths in the sub-Saharan African region could jump to 769,000. That's double what they're seeing in other years. Routine immunization has been massively impacted. According to Gavi, 74 countries globally have already been impacted because of the measures that have been put in place to combat COVID. More than 117 million children are at risk of missing out on measles vaccination. And if we just go back, you just realize what that effect would be. If we're going to miss out on measles vaccination and we're looking at an R number of 16 on measles, you can understand that we could very well, in the African context, certainly, on top of managing a COVID pandemic, we may very well start seeing outbreaks of measles just because it is so infective. And if we're unable to reach them with vaccines, that is going to be a problem for us in the coming months. And then, as we mentioned, TB is still the top killer at the moment. And in South Africa, we've seen a 50% reduction in tests of TB. So if we're testing less, we're diagnosing less, we're treating less. And this obviously all is a direct impact of some of the things we put in place to combat this new pandemic. In terms of prevention and treatment options, depending on what source you're looking at, these numbers will vary. But broadly speaking, they're currently looking at repurposing existing drugs, and those include antivirals. Antibodies is a big part of the research, and that is mostly to combat this hyper-inflammatory state that you sometimes go into to help reduce that. So that's the purpose of the antibodies, whereas the repurposed drugs is more to combat the virus itself. And then very importantly, from a prevention strategy perspective, there's a big race in terms of trying to find a vaccine to prevent the disease altogether. So I have to use the opportunity to just tell you a little bit about Sanofi as well and what it is that we do. So very broadly, we have 4 global business units, 3 core business units, which are specialty care, general medicines, and vaccines. And you'll see that we're thankful to be involved in some of the research for treatment options and prevention options in each of these global business units. And then also a standalone business unit that is our consumer healthcare division. What is it that we're doing in the current COVID-19 situation? So 100% of our manufacturing sites are open and operational at a 90% capacity compared to business as usual, which I think is a phenomenal performance across the globe. Business continuity is secured. That is that we're continuing in our efforts for access to medicines, and at this point we don't see a major impact in providing access to those medicines. Clinical trials, we have about 300 clinical trials at various stages at present. They're largely maintained, although to a large degree they have also been impacted by the current COVID pandemic. And very important for us is to keep our employees safe. 20,000 employees are currently working in industrial sites, as I've mentioned, about 80,000 employees working from home for about 6 to 7 weeks now already. So where are we involved in the treatment space? So from an anti-inflammatory perspective, those are the antibodies that we spoke of to combat that hyperimmune response that individuals go into. In conjunction with Regeneron, we're working on sarilumab trials to see if those will be effective. And really the purpose of these antibodies is to be given to individuals that are in a very severe state of the disease, to help combat that hyperimmune response. Repurposing of medicines, hydroxychloroquine is actually intended for use in malaria, but certain early studies have shown some benefit where it's been used for COVID, and now large-scale trials are being conducted to really confirm whether or not there is a benefit for using this medicine. From an over-the-counter perspective, we're also investigating certain diagnostics to use smartphone-based self-testing as a solution, and the availability here is expected towards the end of the year. I work in the vaccines division of the company, so I will spend some time explaining to you what we're doing on the vaccine side. So I think Sanofi is very well positioned to look for a vaccine for this particular disease, partly because we actually started investigating a vaccine when SARS came out in 2002, 2003. And when we wanted to go into clinical trials or testing of the product, the disease disappeared. And it was not possible for us to really take that vaccine further. But we really are currently providing vaccines on a really broad spectrum of diseases. And we've also entered the race to find a COVID vaccine. And I promise I won't make this too technical, but there's 2 main vaccine candidates that we're looking at. The first, which is called this baculovirus recombinant technology. We are currently making a flu vaccine on this technology. Why is this important? Because if we're able to make a COVID vaccine on the same technology, it means that the infrastructure exists to immediately go into production. And that is why we can look at an existing capacity of 100 to 600 million doses that we can extend to 1 billion doses, hopefully, and in 12 months' time. And when you go into the vaccine component, I think it's important to mention that there are many hurdles to overcome in vaccine development, one of them being the time that is consumed. But broadly speaking, the 2 big ones you're looking at is you need to get a suitable candidate, so a vaccine that actually works. And you can make that in a lab if you need to, and you can test it in a small quantity of humans, and then you show that it works. But the next big hurdle you need to overcome is manufacturing at scale. That requires a large amount of resource, a large amount of infrastructure. And that's why we're really excited about this candidate, because the infrastructure and the resource to manufacture at scale already exists. Our second candidate is a little bit more experimental. That is an mRNA vaccine approach. Currently, there is no mRNA vaccine. It would be the first if we're able to do it, and we're working with Translate Bio on this. but what makes this a really promising avenue is that the capacity is exponential in terms of what you can manufacture in a very short period of time. So that's broadly just the two vaccines that we're working on. The question everyone always asks is, when will it be available? I think important again to manage expectations here is we can't manufacture this overnight. Normal vaccine development can take 5 to 6 years. It can take up to 20 years to develop a new vaccine. So we're hoping to churn one out, and globally we're hoping to churn one out in 15 to 18 months, which would be unprecedented. It would be the shortest development process for a new vaccine ever. And certainly governments, regulatory bodies are all standing at the ready to see where we can implement some innovative techniques to get this onto market as quickly as possible. And certainly the hope is that many of the other vaccine candidates in development now will also be successful, because even if you look at these large volumes that we can potentially produce, it's certainly not enough for a global population. So we're hoping as many vaccine candidates as possible come to the stage where we can actually use them successfully in humans. So I'm almost at the end of my presentation. And if we ask then, what does the future hold? So the important part here is managing expectations. So here you see sort of possible outcomes of the disease process. And you see that and this is really the most likely outcome of what we're potentially looking at, is that we'll have these peaks and valleys in terms of new infections, in terms of reduction of infections, and then certain areas where we see small outbreaks again. And that is really because roughly 60%, and I said here of South Africa because I quoted from an article, but it's true for a population at large, that about 60% of the population will need to get infected, irrespective of what we do, before we start developing some form of herd immunity. So the countries really need to go into that sort of infective process before we start seeing some sort of reduction in it. The other reason why you see these peaks and valleys is because we're not sure for how long you will be protected, even if you've had the infection. If we take a leaf from the other human coronaviruses, those are seasonal, so we see them in winter seasons. But we also see that the duration of antibodies is probably about 8 to 12 months, and then you can probably get reinfected. So it's possible that this coronavirus might follow the same process, but at this point, we're not entirely sure just yet. So those were my thoughts, and I'm going to stop sharing at the moment. I've got some sort of backup slides we can go to if we need, depending on where the conversation goes. But I'm happy to start taking your questions at this time and to start having a conversation.
Cool. Thank you very much, Thinus, for that brief introduction to the virus itself. At this point, like Thinus said, we're going to have a really open opportunity to engage in a dialogue, to ask questions, and to really understand where we are at with this virus. I think there's a lot of information that we are receiving at this moment with regards to COVID-19, and really this is the opportunity to sort of clarify that. So please, if you do, we have quite a few questions already, but for those who haven't yet asked their questions, you can either do so in the Q&A box below, or alternatively, you can raise your hand and you can ask your question directly to Thinus. So we have a question from Xavier. Thank you, Xavier. And he asks, how can we explain the slow level of death in Africa and especially in South Africa, called the mystery of SAF?
Okay. So I think first and foremost, an important concept we need to discuss within sort of epidemiology of infectious diseases is that you can't take the data hard and fast, right? When we look at data, we look more at trends than we do at absolute numbers, because we also have to admit that those numbers are not the absolute numbers, right? Even for the number of cases. So South Africa is now at about 12,000 or 13,000 cases. Does that mean that's the absolute number? Probably not. There's probably a number of cases that we've missed, and that could also potentially be true for death. So we have to take all the data that we see certainly with a pinch of salt, and that's true for epidemiology of infectious diseases across the board. but at this point, there are a couple of postulates on why that is, but we're simply too early in the pandemic to really draw a conclusion to say, oh no, definitely we're seeing less deaths than other countries. And you may have seen in media that they're postulating that certain vaccines that are in our immunization programs means that there's a non-specific immune protection. There have even been some postulates in terms of sort of race being, some races being more prone to infection on the virus. I'm certainly not going to put my head on a block at this point, because it just is too soon to say, and there's no data to really support those postulates at present. And I think, Xavier, partly because we're still quite early in our pandemic. I think many of the other countries, be it European or the US, are much further down the line in their pandemic, and we're still going to see quite a big surge of cases in South Africa and in Africa before we can start really drawing any of those comparisons.
Thank you very much. And then we have a question from Lucille, who asks, has Sanofi put in any additional measures to accommodate for diabetics during COVID-19?
At present, so really for those at-risk categories, I think what we will look to do is really when we start talking about going back to work. And I think, let me just share this little element with you on this slide as well. No, so just in terms of helpful resources that you can look to, and we are going to share these slides with you afterwards. I should have maybe said that before the time so that you at least know. All of these slides have got the sources at the bottom, so you can go read up further on some of those elements that I shared with you and go to the full articles if necessary. But there are a couple of things on this point that I would like to mention. So the diabetics are going to become important when we're saying returning to work. So for now, irrespective of your risk category or maybe additional comorbidities you may have as an employee, if you're working from home, that really is the best protection that your employer can afford you at the moment. The question is going to be for employers, when we start returning back to work, what is going to be some of the elements that we need to take into account in terms of our workforce and in terms of where they are as a risk category. And there I would really implore you, generally I would implore you to go to the National Institute of Communicable Diseases for South Africa's website. They have a phenomenal bunch of resources specifically relating to COVID, and they update that on a regular basis. But they've got this podcast on there which speaks about returning to work and what employers need to take into account. The other important thing that's going to help answer some of those questions is the National Institute of Occupational Health's website. I've got a whole host of considerations of various workforces, be it in the food industry, be it in manufacturing industries, etc., on things they need to keep in mind during this pandemic. For their employees. So this will obviously be shared with you, but I think those would be interesting resources to look to when we start saying, well, we're now going back to work. What do we do with our workforce, and which of our workforce are perhaps more at risk, and should we have specific measures in place for them?
And just to follow up from that question, Thinus, where's the sort of the government stance? You mentioned things such as vaccines for measles, things ongoing that are also highly infectious as well. Do you have any insight into what the government's plan is to deal with that, or can continue to deal with that and maintain that alongside their measures with COVID-19? I suppose particularly for HIV and TB in this context.
Sure. I mean, that's a very important question. You know, from an immunization perspective, so the WHO have issued guidance on immunization or routine immunization during a COVID pandemic. You know, saying what specific things one needs to keep in mind, but really underlying that it's important to continue with routine health measures, especially those health measures that are going to further relieve the healthcare system, right? So through immunization, we're keeping people out of the hospitals, hopefully, and that's why it's important to continue with those interventions. We'll certainly see from a vaccination perspective, because I've already showed you the impact that it's had. We'll see large-scale catch-up campaigns that will probably be run to try and catch up those kids that we've missed. So that's something that governments will certainly put some emphasis on. I think at present, people are really worried about what it means for diseases like TB and HIV, and are people getting their chronic medication? You can already see the impact it's had on testing. So certainly this is something the government will have to pay closer attention to in the coming weeks, in terms of what is the communication that is put out there for people to say, well, you still need to seek medical advice in case that you are ill. But it certainly is going to be something we are going to bear some consequences of in the coming months.
Okay, definitely want to watch out for on that. Then we have a question and a comment from Coralie. Coralie, thank you again. I see you always actively attending our seminars. So she says, a great presentation, and the question relates to those future waves in the last slide. Do they take into account a possible mutation of the virus?
Sorry. Thanks for that, Coralie. So the virus has already mutated. If we look at the genetic sequencing and the mapping of it, there are already some mutations, but not to the extent that we think you're looking at brand new viral strains. And I don't think those mutations are necessarily going to be the reasons of those new waves. It's more going to be a question of what percentage of your population has not had the infection at all. And if that percentage is still quite large, we obviously know that those pockets of individuals will then be responsible for the additional waves until such time as you have sort of a consistent herd immunity within a population. And then the next big question is, and that's the answer we don't have yet, is at what point do your antibodies then start waning or decreasing to the extent that you're then susceptible for reinfection? And that's probably why we're going to see these waves, because it's an element, and I think they're comprised of individuals that have never had the infection or individuals that have had the infection before but now no longer have the protective level of antibodies.
Then we have a question from Damien, who says, what is your view on the lockdown measures put in place in South Africa? Is there other options to limit the pandemic?
Damien, I specifically did not include a slide on this because it's quite contentious, but I'm happy to share with you what my thoughts are. I think generally speaking, the South African and African governments, with the resources that are at their disposal, have done a phenomenal job in trying to juggle many issues on top of now a new pandemic. I think, and that's why I mentioned the whole point of a lockdown, and I think that's maybe where there was a bit of a lapse in communication. The whole point of the lockdown is not to circumvent the fact that we're going to have cases. It's not, Prof. Shabir Mahdi from BITS says it's not a magic bullet. It's not something that's going to mean that you will miss a relatively large number of cases in your population. It buys you time. It buys you time for your healthcare system to not be flooded with new cases. And I think to a large extent, we've been pretty successful in doing that. And the other thing is it buys you time to get ready, right? And that's also something that the governments have done. So there's some makeshift hospitals and in conference centers that have been set up, etc., to hopefully prepare for what is going to be a relatively large flux of cases. We are now at that critical point, I'll say, where I do think the government, and I'm really grateful I'm not in that policy making decision, because it is a difficult decision to make. But we are now at that crucial stage, I think, where from an economic impact perspective, there's been a large sacrifice, and it's now the question of knowing that the disease is going to be with us for probably another year, if not two. Where do you find that balance in terms of the economic impact and people's ability to live, really, and curbing the disease, so to speak? So many of the experts out there are in two camps. Some say you need to continue, but the majority of them are saying, well, now we need to deal with the disease as we do with many of the other diseases that are endemic and that are prevalent in our populations.
Yeah, and I think that definitely leads on from Axel's sort of comments. I'm not sure if you're in a position to answer it, but she sort of says, so in that same sort of vein, if people don't have money or access to food, can't go to the doctor, are we not in fact actually taking more risks, and people will die more because of the indirect effects of the lockdown? And I know that's quite a common within the political narratives at the moment, and a bit of
you're absolutely right, and that's why I thought it was important that we look at what is the African context here, because it's not our biggest problem. Truthfully, COVID at present is not many of the African countries' biggest, and even if we make it really specific, if we say infectious disease problem, right? You see what the burden is of TB, you see what the burden is of HIV and AIDS, and you're right. They need to find the balance of what the secondary effects are of people who are unable to make a living, and who will succumb from other things, be it not COVID-19. So it's a very valid comment.
And then I have another question, I suppose, which is also quite closely related. There's been a lot of mention, I think, particularly in the international media as well, that Africa, due to its, I suppose, high intensity of infectious disease, and it's something quite common that we have to deal with, that we're more equipped or more used to equipped to these kind of situations. What are your thoughts on that?
I think, here's what I will say. I think Africans at large are more used to crisis management. We manage crises on a regular basis, whether it is waking up in the morning and not having electricity, whether it is a brand new disease or infrastructure or roads or whatever it is. I think our day-to-day lives are more accustomed to managing crises and to managing emergencies. So I think from that basis, I think that comment certainly carries water. And you see that in the first world countries. You see the scramble, the panic, in terms of managing issues. And I think it's also a contextual thing, from that perspective, where from a first world perspective, often the onslaught is not that much. But from a baseline perspective in Africa, we manage problems on a day-to-day or a regular basis.
Yeah, I think it's something we've got quite used to. Thanks, Thinus, for that one. And then just another question coming through that wants to know, where are we in terms of the vaccines in the different countries? And just to add to that, I saw a report, and don't quote my lack of medical terminology, but I think there's the University of the Western Cape, or Stellenbosch, I believe, has a pure form of the virus in which they're doing tests. But essentially, where are we in that process, and how are we contributing to the sort of the race for the vaccine?
So the president has pledged quite a large amount of money towards finding a vaccine and resourcing for a vaccine. So that's the first step, which I think is very promising. BioVac, the BioVac Institute, is a company in Cape Town that have, through collaboration with Sanofi, in fact, as well as with Pfizer, over the past, I would say, 8-9 years, taken on a lot of expertise on what it means to be a local manufacturer, because it's such a complex process, the whole vaccine manufacturing process. So, and it's obviously not on COVID, but on other diseases, they have now taken on board quite a lot of expertise in terms of what is vaccine manufacturing, what is required within the sort of manufacturing chain. So they essentially have 300 employees that are highly specialized in the vaccine field, and are currently working on vaccines that are made available in the expanded program on immunization in South Africa. So there is a local manufacturing partner that one could potentially leverage as we go down the vaccine manufacturing process. One thing I can be really proud of saying in the Sanofi context is that we have already done quite a large scoping exercise across the globe, so that once our candidates become available for human testing, it won't just be in Europe or in the USA. We will be testing across Africa, across the globe, in as many populations as we can, that we can also then make the vaccine available there at some point. But that's something I'm really proud of, that we're really going quite global and quite broad when it comes to the phase 2 or 3 trials. But from a timeline perspective, really, I think in the short term, it's not our solution just yet. In the medium to long term, certainly that's where we hope to position the vaccine.
All right. And then just on Sanofi as well, we have another question. If you could just maybe just expand or give us a little bit more detail about your technology that you're employing, the self-diagnostic via the smartphone. What exactly is that technology about?
That's the one I know the least about, right? Let me just see. I think I may have, let me just find this here. Okay, so it really is our most recent effort to develop an over-the-counter self-testing solution. That's in collaboration with a California startup. So early in the crisis, the WHO called for rapid, reliable testing. That's a priority measure to manage an outbreak. However, testing is still not widely available, and there is currently no home test. So the collaboration with the startup aims to provide a smartphone-based solution. It can be carried out at home without a healthcare professional or laboratory test. So let me just finish this for you. The test is designed to detect the virus from respiratory samples. It gives results in 30 minutes or less. It's based on a combination of Sanofi's clinical research testing experience and then the startup's unique technology that uses smartphone optics. That's built into iOS and Android phones. So that's the majority of the information I have for you at the moment. But yeah, it's pretty promising, and the goal is to have the self-testing available before the end of 2020.
Thank you for that. And then just a quick reminder, I think I've got a couple more questions that have just come through. If anyone wants to ask any questions who haven't done so yet, please, this is your opportunity. I think we'll take a last round of questions before we'll wrap up today's session. So please, you can either type your questions in the Q&A box, and I see everyone is a little bit shy today. Perhaps it's too early in the morning on a Thursday, but please, you're welcome to raise your hand and also pose your questions directly. As you all know, we're all stuck at home, so we'd love to hear everyone's voices. So I'm just going to deal with the last couple of questions. So please, last opportunity before we wrap up. I see we have a question from Lucille again, and she asks, or comments, Dr. Marais, thank you for your time and all the information on a personal level / daily basis. What can we do to contribute to the efforts in the prevention of the virus to affect people at risks until a proper solution comes? Masks, home office,
yeah.
Any additional recommendations?
Thank you for that, Lucille. I think, and you know, it's Prof. Marty had a webcast with the editor of the Daily Maverick, where he spoke about the lockdown situation and the fact that we really are now at a precipice in terms of we can't impose a lockdown indefinitely, and we probably now need to start living with the disease. And an important point he made there is that it's going to be the population or the individuals need to take a personal responsibility. And what he means by that is the anti-infective measures that have been proposed, the washing of the hands, cough hygiene, those things we all need to take to heart personally, and then if you are ill, to take the option of self-isolating and making sure you don't spread the virus to someone else. So those are the first things, I think, so where we each need to take responsibility. I think it's important that you ask the mask question because we just have to address that. I'm often worried that when people wear the mask, they put all their hopes and confidence in that mask is going to prevent them from getting infection, when the real reason for wearing the mask and why it's important to wear it in the middle of this sort of pandemic situation is if you are ill, is so that you don't spread the virus to someone else. And because we've seen with COVID that such a large percentage of individuals can be completely asymptomatic, meaning they've got the virus, but they don't cough, they don't have a high fever, they don't have any shortness of breath. So they go about their daily lives as if nothing has changed. But if all of those individuals also buy in and make sure that we're all wearing the mask, that helps with the spread of the virus. And that's why it's been recommended to wear the mask, is not to prevent yourself from getting the infection, but in case you have an infection on board, you don't spread it or cough or become too much of a source of the spread of the infection. And then on your point of home office, yes, I think to a large extent, if you are still able to work from home, I think that is still first prize at this point in time. When it comes to essential services, obviously then if they need to deliver a certain service, that's when employers really have to look at how do we do that, and innovative ways of saying, well, we can't be at 100% capacity, but maybe in shifts, people can come back to the office if there's specific face-to-face meetings that need to take place. And then at the workplace, obviously, I think, and you'll see in the resources I posted, that's where many of these recommendations come into play. But if people then start going back to the office, obviously one needs to have at the very basic temperature monitoring, the same infection prevention measures need to be in place. So hand washing stations need to be available. People need to have access to that. Office spaces can't be of such a nature that people are in really close contact to each other, and they should be able to observe some kind of social distancing, you know, to make sure that we don't become sources of further spread of the virus.
And then we just have a final question, also on a personal nature. So it says, today, if I were to contract the COVID-19 virus, what would be the sort of the procedure? Obviously, I go get tested, and then I know we have obviously different severities. How would they be classified? And for example, if you are sent home, I mean, do you take a Panado? What is the kind of protocol on that? And how do we,
I think it's a good question. So as a start, if you are getting ill, and that's really characterized, you know, the early symptoms is characterized by fever and by a cough. Now, other things are also characterized by a fever and a cough. So also ask yourself, who have I been in contact with? Was there a potential source of the infection I got? But really, as a start, yes, I think go and get tested, and many of the laboratories now provide these tests. So to get tested is not that difficult. You may wait a bit for your results. So depending on where you are, I know there's a bit of a backlog in terms of results coming forward. And really, the treatment recommendations for mild or early forms of the disease is symptomatic. So treat your fever symptomatically. So be it with a Panado to help reduce your fever. And then I think the important point, and this is really the only place where you need to start seeking medical advice, is if you struggle to breathe, if you find you've got shortness of breath, if you get up from the couch and you need to go to the bathroom and it feels like you've gone a marathon, then your disease has progressed to a stage where you definitely need to seek additional care. But we can confidently say at this point in time that the majority of the disease can be managed at home with symptomatic treatment, and the majority of people recover from it. So I think we also need to manage the panic that goes with it. Yes, we need to be vigilant. Yes, it's an important infection that we need to try and curb. But if we look at what the data tells us, the majority of infections remain mild, and all of them recover.
Okay, perfect. And I think on that note, we have no further questions. So Thinus, I don't know if you have any last comments you'd like to wrap up with. Otherwise, I'll do a quick wrap up.
I just want to say thanks, Amy, for the opportunity. I really enjoyed it. Thank you for your interaction and for the people being so active on the Q&As. It's always nice to get the feedback. So that was phenomenal. And if there's a follow-up, or if you guys want to use me again, please feel free to do so. And good luck to everyone where they are, and stay safe, and hopefully we'll talk again.
Perfect. And so from my side, thank you very, very much to Sanofi and for your time, Dr. Marais, today. I think it was very informative. And like he said, just to echo what you said, the slides are available, so we will distribute those. And if you have any sort of follow-up questions that you would like to ask, please do get in touch with myself or anyone of the FSACCI team, and would be happily put you in contact with Thinus or the relevant people to answer those questions. I think at this time it's important to have that. You can also consult our Q&A page on the FSACCI website, where we have a variety of experts who are doing just that. So please stay safe and stay informed. A final thank you to everyone who did who came today. Thank you very, very much for your time, and a thank you to the Belgium Chamber of Commerce as well, and to your members. It's always a great pleasure to collaborate with our friends and our sister chambers as well. So thank you for your time today. And on that note, I'd like to wish everyone a very good rest of the week, and we will see you soon. Thank you very much.
Thank you.